Association is taking a good part of the Arab world. On the history, it's sometimes difficult for me to talk about history of cardiology in Qatar or history of Gulf Heart Association. The problem that's facing me is that I have a role in it, and that's not history if you are talking about yourself. But I have to give you some introduction to it. In 1979, Gulf Minister of Health, a meeting in Oman, formed a committee for heart disease. And in our audience, one of those ministers of those days is present in this hall with us today, Dr. Ali Fakhro. In 1999, the GCC Minister of Health, because at that time, one of the ministers was a cardiologist. It was an occasion for cardiology to come again for discussion. They formed a committee for heart disease. The purpose was mainly prevention. And since I was the cardiologist, they put me as chairman of that committee. And so this meeting was for GHA is a very important historical meeting that took place in Muscat. This is Dr. Ali Musa, Minister of Health at that time of Oman, and that was me with him. And then between 2000 and 2001, the preparation was started. We had 2 meetings, and even though this is a committee, I proposed to my colleagues in the committee, which was formed by a minister, which is a government, that this is our opportunity now as colleagues to consider having a society of our own. Anything governmental will not last. But if it's private and public citizens, it have more chance to last. We all agreed, and we proceeded to consider the committee as a nucleus for the society. We polished it further, and they again asked me to be in charge of the committee, of the nucleus. We had a second meeting, and this was the meeting in Doha. And as our recommendation went to the ministers of health, actually I did tell them the truth, that we have decided to make a society. And I told the ministers that we need your help now in establishing it. And later on, it will be separate. And I explained to them that it must be done for the sake of our citizens in the Gulf, because this society is going to work for the same goal that the minister were working on, is raising the health care. In our situation, is cardiac care. They all agreed, and they all pledged to help forming and supporting the GHA, as we call it later on, from the beginning. And we had decided to have our first cardiovascular meeting in Doha. But that time, it was supported by government. In fact, the first 2-3 conferences were heavily supported by the government in Qatar, Oman, and Bahrain. During that meeting, we announced the birth of Gulf Heart Association, 202. And these are the founder. Some of them are here with you in the hall, majority of them. What was the main goal? Our main goal is to improve cardiovascular care in the GCC countries. And what did we accomplish in the last 8 years since then? First, when it comes to the research, one of the main aims was to have a registry for the GCC countries. And we took, the first one was acute coronary syndrome. And I'm glad to tell you that as this was the only successful collaborative multi-center medical study in the Gulf, and again, if it was governmental, it would not succeed, but it did. And we had so many publications, and today you heard some of the result. It did help, because as you see today, when Dr. Habib presented the data, it shows the progress. It showed that some of the, on the first phase, some lagging information and some behind, it was improving on the second stage within 6 years. And so we are helping in raising the standard of care. We have periodical, professional journal, pamphlet published, and this is the heart view that you saw, and some of the pamphlet. I will go faster. And as one of our aim is to have links with international and regional organization in the same specialty, we have already established relation with the European Society of Cardiology, and today we have discussion with the American College of Cardiology, and we are planning to have a cooperation with them also. And on the scientific, I will give you briefly tell you all these conferences that we had until we reached this 8th one. The first one, as I told you, was in Doha. Second in Muscat. Third in Kingdom Saudi Arabia. The fourth was in Bahrain. At that time, they have a good-looking minister. And then we went to Kuwait on the 5th, and then Sana'a, Yemen, and last year in Dubai, and now you have it in Doha. We have also every year one symposium. Symposium is very small, a few hours, and also we take rotation in the countries. First was in Doha, then Bahrain, then Yemen, and excuse me for the Yemeni for putting somebody with a cot, and then in UAE, where you see the tallest building in the world now, and then in Muscat, Jeddah, Kuwait, and back to Doha. And so these are enough now for Gulf Heart Association. I will briefly go and tell you about the medicine. The modern medicine or the Western medicine is only recent in this area. During the time I was a child in our village, there was no hospital, there was no modern medicine, and it was only traditional medicine was working. Modern medicine came only actually in the 40s, when the oil from underground was pumped out. Modern medicine took a ground in the Gulf. When people have chest pain, they use dates. They heated the date and rubbed on the sternum. At least the patient feels there is something is done for them. I will not go into herbal medicine. Everybody is using it around the world. But bloodletting is a very, very old practice. It was a practice by the Egyptians in the old days. The Greek practices, and they thought it cured diseases from tumor to tonsillitis. and stabilize the body imbalance by releasing blood. However, for some reason in the Gulf, it was not popular and not much done. And probably the reason, I have to admit, comparing to the time of the Abbasi period in Iraq and the civilization of the Arab in Spain, in the Gulf probably we are not as sophisticated, because this requires a doctor, a physician to do it, not the barber as we practice here. And the second one, instead of bloodletting, hijama is cupping or blood sucking. What they do is they do some laceration on the skin until it bleeds, then they put the cup, suck the air, and blood will be collected there. This is the practice still until today and all over the Gulf. It did not die. And it started by the Babylonian, 3,300 BC. Then the Egyptian, then Chinese, and then came to the Arabs. Ibn Sina put limitation. Below the age of 2 is not allowed, above the age of 60, not allowed to do it. These are their tools that used in the old time. It's mainly horn, and modern days they made the sophisticated cups. When we were in Oman for the meeting, Oman had a center for traditional medicine. So I went to take pictures, and it was done more professionally and clean method in Oman. At the old time, before the oil, people are living on pier diving. Before they go to